Bismillahirrahmanirrahim. Assalamu alaikum. I am Hassan Sohail Bhatt, working as a faculty member at the University of Lahore. Today, I will give you a lecture on the subject medical physics, which is a subject of PS cardiac technology. The topic of my lecture will be nuclear medicine or nuclear medical imaging systems. In this lecture, you will get to know about the nuclear medicine imaging, its introduction, and various uses or application of nuclear medicine imaging. These are the contents of lecture we will cover today. First of all, I will give you an introduction on nuclear medicine. Then I will explain you how nuclear medicine works. Then I will give an in-depth detail about what is isotopes and various application of nuclear medicine. First of all, what is nuclear medicine? Basically, nuclear medicine is a medical technique which uses or employs radioactive substances for the diagnosis and treatment of disease. You can also say that nuclear medicine is also called endoradiology. Basically, endo means inside and exo means outside. So nuclear medicine is also called endoradiology, which means radiology done inside out. The reason is that it's called endoradiology is that the nuclear medicine records radiation emitting from within the body rather than radiation that is generated through external source like conventional X-rays. As you know that if we talk about conventional X-rays, we produce radiation or X-rays from external source like X-ray tube as compared to within the radiation, where nuclear medicine emits radiation from the body, not through external source. This picture clearly depicts the difference between conventional radiology image as compared to nuclear medicine image. Here you can see that in the left side, you can see nuclear medicine image, where you can see the function of the internal structure as compared to the right side of the picture, which shows the conventional X-ray, where you can just see the internal, you just see the bones, image of the bones. You can see just the anatomy as compared to function in nuclear medicine imaging. Another picture here shows that what's the difference between conventional radiology as compared to nuclear medicine imaging radiology. In conventional or common radiology exams, you see that radiation is produced or thrown from outside the body and that radiation enters into the body. These waves then pass through the body and it gets absorbed in the part of the region which you are interested, and we get image of that internal structure within the body. But in nuclear imaging, what happens instead of throwing radiation or providing radiation to external source like X-ray, here we administer or deliver, you can say pharmaceuticals like radiopharmaceuticals ready processed inside the body through injection or through orally. And then with for time being, if you when you wait, from within the body radiation emits, and that radiation when it emits, we scan it through gamma camera or PET scan, and that provides an image of internal organ. You can also say that nuclear medicine just scans. Basically, it emphasizes not anatomy, but it tells the function of the internal structure. So that's why it's called physiological imaging modality. As you know that anatomy means structure, physiology means function. So nuclear medicine mostly emphasize on the function as compared to anatomy of the body. Two most common technique, two most common device which uses physiological imaging modality of nuclear medicine are SPECT scan and PET scan. SPECT scan means single photon emission computed tomography, while PET scan means positron emission tomography. These are the two most common imaging modalities in nuclear medicine. Now let me tell you about how nuclear medicine works. First of all, what happens? The patient is administered or delivered with radiopharmaceuticals through injection, or you can say through orally. Then after that, the patient waits for a while. You can even say that few minutes or it takes hours for the patient to wait, so that radiation or radiopharmaceuticals travel all the body or the specific region you want. After waiting for few minutes or hours, what happens that radiopharmaceutical emits radiation within your body, and then you take the patient to the PET scan or gamma camera, as you can see in the picture at the right side, third point. And then, as you know, the radiation emits from the body. Then PET scan, gamma camera just take an internal image of that specific region when radiation comes out. It has detectors, and the detectors, what they does, they scan the image and provide in the computerized form. Now, in the nuclear medical imaging, radiopharmaceuticals are taken internally, for example, intravenously or orally. So, pharmaceuticals are administered through injection, intravenously or orally through mouth. Then what happens? External detectors like gamma cameras capture and form images from the radiation emitted by the form of radiopharmaceuticals which are inside the body. So it means the radiation comes from within the body, and from within body it goes out. This process is unlike a diagnostic X-ray where external radiation is passed through the body to form an image. So that's the main difference of nuclear medicine technique, where radiation comes from within the body as compared to the conventional X-ray where radiation is provided from external source. Now, what are isotopes? As you have read in chemistry, that isotope is basically one or two more species of the same atom having same atomic number and different atomic mass number. Like for example, if you talk about hydrogen, you talk about carbon. Carbon has three isotopes: carbon 12, carbon 13, carbon 14. But the difference is their atomic mass. So these are called isotopes. There are two types of isotopes. One is called stable isotope, and second is called unstable or radioactive isotopes. Stable isotopes, you can say, have stable proton-neutron combination, and they do not show any sign of decay as it is stable. Since you can say that stable isotopes don't decay, they do not produce any type of radiation, and they are not, you can say, associated to any health risk, or they are not detrimental to the body because it's stable. They do not produce any decay, any radiation. Now, if you talk about second part, which second type, which is called unstable isotope or radioactive isotope. So basically, radioactive isotope have unstable combination of protons and neutrons. Due to their instability, they have a sign of decay and they emit radiations. And there are three types of radiation that are emitted by radioactive isotopes: alpha, beta, and gamma rays. This animation or this picture you can say here shows unstable or radioactive isotope, where you can see that it's emitting light, it's emitting radiation due to sign of decay. Now, what are the uses of radioactive isotopes? Radioactive isotopes are mostly employed in agriculture, in food industry, in pest control, archaeology, and medicine. One of the most common example of radioactive isotopes are used in carbon dating. Basically, carbon dating is a technique where we see the age of a species. Like for example, you have seen nowadays archaeologists discover any mummy or any old bone, and they tell you about the age of that bone, how many years old that bone is, and how they tell is by carbon dating. Basically, in our human body, When we die, there are carbon remains in our. When we die, there are carbon remains, and we are carbon-bearing items. And that carbon is basically an isotope carbon 12 or carbon 14, not carbon 12. As I told you, carbon there are three isotopes: carbon 12, 13, 14. When we die, carbon 14 remains on our body. So using carbon 14 as a radioactive isotope, they detect how many old that bone is or any mummy is by carbon dating procedure. This is the most common example of radioactive isotope. If you talk about medicine, gamma rays emitted by radioactive elements are used to detect tumors inside the body. To detect cancer or tumors inside the body, we use radioactive isotopes. Another example is food irradiation, the process of exposing food to a controlled level of gamma rays, which helps in killing certain bacteria so that food becomes safer to eat. Radioactive isotopes have many useful applications in medicine. If you want to diagnose cancer, one of the most common radioactive isotopes used in medicine is cobalt 60. In addition, iodine 123 is also used as a radioactive isotope. So these radioactive isotopes are used for diagnostic purposes as well as in research or metabolic processes. Bone scan. This bone scan is also employed in nuclear medicine imaging. First of all, what is the purpose of bone scan? Here you provide radioactive isotope or nuclear medicine imaging to detect stress fracture in bone or non-malignant bone lesions. Non-malignant means non-cancerous. Lesion means injury or wound. So it's used for stress fracture, detection of stress fracture, diagnosis of stress fracture, non-malignant bone lesion, bone infection, or spread of any cancer to the bone. Another use of nuclear medicine is myocardial perfusion scan. Myo means muscle and cardial means cardiac. It means it takes from the root word heart. So myocardial perfusion scan is used, you can say, to identify coronary artery disease. It also provides overall prognostic information or overall risk of cardiac events for the patient. This is an image of nuclear medicine imaging, or you can say diagnosis of myocardial perfusion scan. In the upper part, you can see the stress image. In the lower part, you can see the rest image of myocardial perfusion. Another employment of application of nuclear medicine is in parathyroid scan. Basically, it's a nuclear medicine parathyroid scan demonstrates a parathyroidic adenoma. Basically, in your parathyroid, there is, you can see, a thyroid gland, and in that thyroid gland is the purpose of thyroid gland is to regulate calcium levels in the person body. In the next image, in the next lecture, in the next slides, you will see the image where the study was performed with one radioactive elements. Column 1 will show that radioactive element, and one second will also show another radioactive element. And by subtracting that two images, we get the image of parathyroid scan. This is the anatomy of thyroid and parathyroid glands. This is the thyroid gland. In the front view, you can see thyroid gland, and the back view, you can see parathyroid glands. Basically, parathyroid glands are used for regulation of calcium levels. So when there is excess of, you can say, tumor, we detect it through nuclear medicine imaging. This is the image you can see here, parathyroid gland. Another technique of nuclear medicine imaging which employs is used for hepatobiliary scan. It is also called HIDA scan. Hepato means liver, biliary means bile. So this hepatobiliary scan is useful in detection of gallbladder disease. This is the image of hepatobiliary scan. Then comes pulmonary ventilation and perfusion scan. This scan is also known as V over Q scan, and in this the nuclear medicine used for evaluation of pulmonary embolism. Now, what is pulmonary embolism? Pulmonary comes from the word lungs. So it's a condition in which an artery is blocked by embolus. Embolus is basically a blood clot that is formed in a place and it circulates from one place to another. So that's called pulmonary embolism. This is the image of pulmonary, or you can say embolism or embolus in lungs. Here you can see that there is a blood clot in the femoral artery. What happens? It travels and goes to the lungs and it creates infarction. The ventilation perfusion scan is nuclear scan, so named because it studies both airflow and blood flow in the lungs. That's why it's called V over Q. V means airflow ventilation and Q means blood flow or perfusion. This is the image of pulmonary ventilation and perfusion scan. Then comes thyroid scan. Thyroid scan with iodine 123 is used for the evaluation of hypothyroidism. Now, what is hyperthyroidism? Basically, is a condition in which there is an excess amount of thyroid hormones that circulate in the blood. So, to detect that, we use thyroid scan, which employs iodine 123. Thyroid gland is vital hormone gland. Its main role, or you can say its major role, is in the metabolism, growth, and development of human body. It also helps regulate many body functions. The thyroid gland produces hormones that regulate body's metabolic rate, controlling heart, muscles, and digestive function. And its main role is for the brain development and bone maintenance. This is the image of thyroid scan where we use radio tracer as iodine 123. These are the learning outcomes. Where in this lecture you were familiarized about nuclear medicine imaging and its various applications. These are the references and links. Thank you very much. Assalamu alaikum.